Remember to just like wait a couple seconds, Paul.
We have done it. Dentistry has created an extra set of bionic shark teeth. My name is Paul, Dr. Nacho Goodman. I'm here with my good friend and key resource and sponsor, Dr. Tom Jackson, creator of the AutoFlosser. And he's going to share with us a product he's created to help our patients take care of this extra set of implant teeth that we can deliver. Tom, welcome to Talking Nachos. Share with us a little bit about your dental life. I know you from years gone by, well before Facebook. You're a high-level dentist. Share with us what you do in your daily dental life.
Yeah, so right now I'm a full-time periodontist, prosthodontist right outside of Chicago. So the practice over the years have kind of really just morphed into just advanced adult comprehensive dentistry.
And I know the legacy of PerioPros at Penn and all these places with Kois is awesome, but how has your shift been? I mean, share with our audience from teeth to implants. You're doing more implant cases, more full arch implant cases. Tell our audience a little bit about that.
Well, I have to tell you, there has been a shift from teeth to implants, because if you maintain teeth long enough, you understand that they fail, right? And there's things that happen to them that don't happen to dental implants. So if you do this long enough, you start fixing your old dentistry. And
I got a good line for you, Tom. Say this. This is great. So when your patient comes in and they're like 68 and they're retired, say, your teeth did a better job than you, because now it's time for them to retire. You've already been retired. So I say, teeth don't fail. They're just ready to retire and be ready for another set. Tell us, are you doing fixed implant cases, removable cases? Has this become a bigger part of your daily dental life?
You know, I have to tell you, around the Chicagoland area, these fixed all-on-4, all-on-X type bridges have become quite popular. So people will come in and actually ask for that type of service by name.
And I know you mentioned you're a periodontist too, so you do both sides. So while we know that, my friend, the implant cannot get decay, taking care of them gum tissue-wise, bone health-wise, I've seen some challenges with that. Tell us how the AutoFlosser can help and why you've created it.
Yeah, right. So although implants are kind of resistant to all the problems that happen to teeth, except for gum disease, right? Plaque will still affect gum disease around implants, and we call that peri-implantitis. So the challenge is, you know, once somebody has received one of these prosthetics, is you got to keep it clean.
Yeah.
And that truly is the challenge, especially with some of these all-on-4 dental implant hybrid restorations. Right. The seam, you know, the connection between the prosthetic and the tissue is different than it is around like a normal single tooth crown. It's way up underneath the lip, and especially in the upper arch, where you don't want your patient lisping when they leave the office. You have to make that seam tight. Otherwise, air and bubbles will blow through and they're not going to be real happy. So now you've got a tight seam way up underneath their upper lip. Now you got to clean it. And it was, let me say, practically impossible to do so.
Yeah. I mean, that's what I interject that, you know, I share with people when we're making decisions on their decision, whether removable, clean your dentures underneath the sink that you snap in and out, or fixed. They want fixed. But I say, are you the type of person who cleans underneath your couch? Because you're going to have to get under that couch, and it's hard to clean. So I've struggled. I've been doing these cases for years. So I really am excited to hear about the AutoFlosser. How does it help solve this problem of getting underneath the seam?
Right. So I mean, in my experience prior to the AutoFlosser, I would struggle chairside demonstrating with my patient, how to get this floss threader into that seam. So the challenge is, you have to reach up underneath your lip, and you got to get the tip of that floss threader at the right angle, at the right spot, with enough motion and enough dexterity to push it through to the other side. That's wherein lies the problem. That's wherein lies the challenge. So the AutoFlosser solves all of that.
That's awesome. And you were with me with Dr. Howard Freeman, and we did a big veneer case. I did nothing other than watch. I'm one of my closest friends who's a dentist. So I'm going back to this veneer case, and usually we gave patients with veneers a night guard to protect their teeth, right? Wear this like a bumper on your car. Now I see that the AutoFlosser can fit in with small, medium, and large implant cases to give this to your patients. Tell us how a dentist could gift it if they want to and build it into the case, or perhaps purchase them from you and have them on the shelf, so to speak, and charge the patient what it costs.
Right. So, you know, the AutoFlosser really could be part of a restorative dentist's inventory.
Yeah.
And that's quite simple. I mean, you just go to the website, which is www.theautoflosser.com, and you can put in an order for any number of AutoFlossers to make it more affordable, to be able to have our dentists pass along this type of product to our patients, there's a discount for a bulk purchase. And with that, the restoring dentist or the treating dentist can choose to do with what they want. And like you said, we give night guards. I see this as a very similar type of value-added service. Give something where they can actually now clean their prosthetic, because it just amounts to health in the end. It amounts to longevity.
I'll use this term. It creates shared responsibility, because I know that dental joke, and Ariel's a hygienist. You say to the patient, "When was the last time you flossed?" They said 6 months ago. You were there, right? So, now it's like you're giving shared responsibility. What is kind of amazing to me, Tom, and I'm enjoying talking to you about many things. It's like I do these giant cases, right? Patients invest $40,000 or $50,000, and they don't take care of it. They wouldn't do this to their car. Their car service light goes on, they go veering off the road to the service station, right? But
right.
I try to share with them that we're not done at this point, right? You have to maintain this like your car. Imagine buying a fancy sports car, not maintaining it. Now we're providing them this AutoFlosser to take home with them and do. Is it easier? Is this something you can demonstrate in office to your patients, how to use it and how they can order these refills?
Yeah, absolutely. So, with the AutoFlosser from a demonstration purpose standpoint, there is the ability to receive these AutoFlossers at a discounted fee, to be able to use as a demo unit. And so if you had a demo unit sitting in your chair side drawer, at the time of placing the prosthetic, you pull it out of the drawer and you show them how to use it.
And also I'll share this, and this fits with the night guard too. So while I'm doing new implant cases, I also have people come in with a history of bridges, right? And a history of work that needs maintenance. So it seems like a great opportunity to just have a nice value added. Tell us, what's the cost to the dental office or the patient for the AutoFlosser?
So the retail cost, if you went to the website right now, the cost would be $45.
Awesome.
Purchasing in bulk, a minimum order of 25 units, the practice would get 30% off of that.
So you're an awesome sponsor of the group here, Dental Nachos. So our Dental Nachos audience can save. My dentists, dentists, they like a deal, Tom. I don't know if you know them, but we know our people, very into the deal, right? They're crown crafts, $2,000 works of art, no deal on those, right? But everything else, cotton rolls deal. So we have a deal for them for buying in bulk, $45 each. And then patients are ordering directly from you on the website for the refills. How much are the refills?
The pack of a refill, and it comes as a 90-day supply, 3 months, auto shipped for $18.
It's such a good deal. I mean, they're investing. I mean, I know we're talking to each other, but if a younger dentist is out there, hygienist, explain to your patients they've invested so much time, energy, effort, and money into these cases. At least invest in maintaining these cases. And I think that you've created this great solution that I think a lot of dentists are struggling with. I mean, have you met dentists, Tom, that when their patients' cases don't go well, they blame themselves? I've met these dentists. Even though they're not home brushing, they still kind of take it to heart.
Yeah, I mean, that's something that we've provided. And I think the paradigm shift here, and you've kind of like touched on it, is that everything requires maintenance,
Right.
Whether it's your car, whether it's the roof on your house, or whether it's your teeth. But I think that somewhere along the lines, we as dentists, we kind of forgot that these things require maintenance. And if they're not maintained, we kind of take that to heart.
Yeah. As we wrap up here, I use this line a lot. So when my hygienist says, this crown's broken, it was 8 years old, I say to the patient, be glad you got 8,000 meals out of it. We eat 1,000 meals a year, because I just think we don't line this up. And I think the AutoFlosser, like changing your oil, putting gas in your car, using the night guard's great. Just tell us one more time, Tom. I think this invention's awesome, where they can go and what kind of deal they can get as being part of the Nacho Group.
So www.theautoflosser.com. And as part of the Nacho Group, which I'm happy to be a part of, with a bulk purchase of 25 units or more, using the discount code Nacho Bulk 30, you'll get 30% off that bulk purchase.
Another discount code named after me. That's my goal, Tom. I don't know if I make any money, I don't know what I do, but I just want discount codes named after Nacho. So Nacho Bulk 30, and this totally genuine. I told my team to order these immediately so I can have them ready to deliver to my patients, because I like to share a gift sometimes. Maybe I'll charge the patient just the cost to cover it, but we're giving them the tools to take care of this. So thanks.
Right. That's the most important thing.
Being here. We really appreciate your support as a key resource and sponsor.
It's been a pleasure, Paul. Thank you.